Hey, welcome back, everybody. I am excited to be joined with Dr. Dan. He owns New Horizons Physical Therapy. We've got another great show for you guys. And before we start, I just want to say good afternoon, Dr. Dan. How are you?
How's it going? Good. Thanks for having me on.
Yeah, you're very, very welcome. We're excited for you to share your business practices, a little bit about your business with our listeners. But before we go there, just for our listeners, this is a show that brings you real experiences of our business owners that we're talking to. This podcast is your go-to resource for learning about the business that shape our communities, and we discover how to make the most of their services, which I think is so important. And if you enjoy the content and want to hear more, please feel free to subscribe, give us a comment, kind of share what you've learned from this episode as well. So with that being said, let's go ahead and jump in. Dr. Dan, tell our listeners, if you don't mind, share with our listeners a little bit about your background.
Yeah, so I've been a physical therapist for 5 years now. I've been in private practice for almost 3 years now. So I'm a UCF graduate. I went there for my bachelor's and for my doctorate, and then graduated in COVID. It was 2020, the thick of it, really. And I was always had my heart set on leaving Florida, but it didn't make sense at the time to leave Florida. So kind of took a job, and it was, the jobs were sparse at that time because of COVID. And eventually I landed a gig with an outpatient clinic through Orlando Health. And this is not unique to physical therapy alone, but like the burnout rate when it comes to healthcare. You get stuck in a position where you're just overworked and you're surrounded by coworkers that are overworked. And it kind of led me down the path of starting my own business. And, I started as a side hustle. I was doing 100% mobile, seeing patients in my off hours, driving to their house, evenings, weekends. And then it just kind of grew. Eventually I was able to move into an office, and now kind of full-time in my business.
I love that. And the transition of what you said, going from corporate America, if you will, to starting your own business. That transition, tell us a little bit about that transition for our listeners.
Yeah, I mean, it's completely different. Obviously, there is burnout as an entrepreneur as well. Like that, it's not isolated to just working in a corporate atmosphere. But I would say when I was working for Orlando Health, it was very, very regimented as far as, getting patients in, getting patients out, and kind of keeping the revolving door going. Um, you know, Now that I have my own practice, everything is done on my terms and the patient's terms. And, it's more of a collaborative process to get them better rather than having oversight by, people who don't even know their name. It's just like top down approach where like, the person at the top of the corporate realm is getting the most benefit, and then everything kind of gets squeezed down to the bottom. And who's at the bottom? It's me, and then below me is the patient. So they're getting the least benefit out of the care they're receiving.
And I think if I hear you correctly, you're building more of a relationship through your business practices compared to corporate America, where, like you mentioned, it's kind of, bring the client in and move on, but without really getting to know them on a one on one basis, right?
Yeah, for sure. Everything I do is one on one. And in physical therapy, that's not common. Like a lot of clinics, they're stacking the schedule, 3 to 4 patients an hour per therapist. And you really can't develop that alliance and that relationship, which is a huge part of helping someone rehab an injury. I mean, there's a psychological component to it as well. And if you don't like your healthcare provider, it's like, are you going to actually be accountable with the things they tell you to do? Are you going to show up for appointments, and are you going to follow the plan of care all the way through? Not if you don't like the person.
Exactly. So when you're talking about rehabbing, a client or a patient, if you will, what does that look like, to someone who's listening?
Yeah, so a lot of my patients, like I'm not first resort. Like they've been chewed up and spit out by the medical system a lot of the time, and a lot of them have tried physical therapy elsewhere before. So they've been dealing with their injury for months, if not years, and a lot of times it comes down to figuring out not only like what are their impairments when it comes to like their mobility and their strength, but also figuring out like what are the things that they're doing on an everyday like on their 24-hour clock, what are the things they're doing that are contributing to, their pain? Because a lot of times, like my patients are pretty active. I see a lot of people that go to the gym, do group fitness classes, or are involved in some type of sport. So I usually tell them, like, if exercise alone is a solution, why are you still in pain? Because there
Mm-hmm.
are other things that are going on the 23 other hours of the day that are contributing to their pain. So really trying to do detective work and figure out, like, what are the things that we need to temporarily change, modify these behaviors, these habits, so that we can slowly start getting these small wins back, so that you're less bad, you're less bad, you're less bad until you're better. It's not a quick fix. True rehab is not a quick fix. I don't think quick fixes really exist. Band-aids exist,
Mm-hmm.
but I wouldn't say that anything that is worth having takes time and dedication and accountability and discipline to actually get there.
I agree with you, and then I like the word which you use in terms of Dr. Dan, detective. The word detective. You're kind of like Sherlock Holmes. You know, you're kind of doing that research with your patient to kind of really hone in on what the issues are. Correct.
Yeah.
That's the bottom line. You know, when I was looking at your website, I know you do physical therapy. You offer sports massage. You offer cupping and dry needing. Can you define cupping? What is that?
So cupping is a modality where I got really popular during I think it was like the 2016 Olympics, when Michael Phelps kind of was in the pool and everyone saw those red dots on his back. So those are from
Hmm.
cupping. So it's a type of therapy where these little suction cups, and it can be done in different manners. It can be done with fire, it can be done with just suction, but essentially you're creating negative pressure underneath this cup, and it creates a vacuum on the skin. And then what it does is it kind of lifts up the soft tissue underneath. So in theory, what it does is supposed to allow for better circulation, which can, bring all the good inflammatory cells to that area and kind of drive out whatever is kind of lingering in that area. And that's in theory. So I always set expectations when it comes to any kind of manual therapy or any kind of thing where I'm using my hands. I tell people that all this stuff is kind of theorized. What it's actually doing and what the research supports is more so. I don't know if you've ever experienced this, but like, say you stub your toe on something really hard and then you go rub your knee. You get distracted from that toe pain.
Hmm.
That's kind of how manual therapy works. Whether it be cupping, acupuncture, or massage, like, it's providing your nervous system with a temporary distraction, so to speak, so that your all these signals from these different pressure receptors or vibration receptors, they're overriding the pain receptors temporarily.
Yeah, that's interesting. I would have never known that.
Yeah.
You know, there are our listeners that are going through, wanting to know how to do some preventive maintenance. Any tips on that that you can give any of our listeners?
Yeah, I would say, I mean, in this country, we have a low back pain epidemic just because of the amount of time people spend sitting at their jobs. A lot of people have sedentary desk work, and um, there's nothing wrong with sitting, but if you're sitting for 8 hours a day and really not taking breaks or utilizing a standing desk, yeah, I would say, now that I'm talking about standing desks, I would say everyone should invest in a standing desk.
Yeah, I do actually have one as well that I'm speaking to you from right now
There you
that
go.
I can stand up and, you know, just kind of stretch because it's so important to do that, for your bones and for flexibility and of course, all this as well. So are there any types of trends that are shaping your industry?
Yeah, I mean, I think to healthcare in general, I think the whole paying out of pocket for a higher quality service. So I have a performance cash based physical therapy practice. So I'm out of network with most commercial insurances. Um, so I think the trend is that people are just getting fed up with what insurance provides, and that's coming into more to light in the news more recently.
Hmm.
So I think more people are just appreciating the fact that, like, you can decide what service you get, and you're not locked into what the insurance company kind of tells you have to go through and what your doctor prescribes to you. So I think that paying out of pocket for a higher quality service, more and more people are learning that's a possibility. But there's still a lot of work to be done with educating the public.
That's interesting too. And it seems like the industry in general, not yours, but the medical industry in general, there's a lot that are going towards just, stepping away from that practice, correct? And
Yeah.
doing it on your own.
Yeah.
which is interesting. We do have listeners here that are listening, and they're aspiring to be entrepreneurs. Maybe they are business owners right now, kind of struggling and trying to figure out how to get over that hump. And from a positive standpoint, anything that you can share with them, maybe one or two tips that you can share with them.
Yeah, I mean, it's all about relationships. You have to plant seeds and, nurture them and water them frequently. And it's about quality over quantity. And that's a mistake I made early on. I think I was just trying to build volume of relationships without realizing that, like, not everyone is going to be a good partner for my business. And you got to find the people that really support your vision and that you can support their vision as well. And have kind of that giver's gain mentality. But yeah, got to get out there and build relationships, put yourself in uncomfortable situations. Cause of like, for someone who's introverted like me, like networking was not something I was doing before.
Right.
And I think that being an entrepreneur over the past 3 years has completely changed my personal life and my professional life as to who I am as a person and my character. But yeah, got to go out and build relationships and don't expect anything in return. You got to give before you can receive.
Very good. I like that. You got to give before you can receive. I want to kind of want you to share a story of a patient, and don't say the name,
Yeah.
but a patient that recalls, like, top of mind, that you was so excited about the treatment that you provided for them.
Yeah. So I treated someone last year. This patient had fractured her hip, and she was actually just visiting America from another country because she was visiting her family and her grandchildren. And they had planned a vacation that they were going to go on in a couple of months from when the hip fracture had happened, and it was already planned. And this was like a giant wrench in their plan. And I saw her first at home for a couple of visits until she was able to come to the clinic, and she was in better shape after the treatment than she was before. Like, she learned a bunch of exercises that she's going to be implementing when she goes back home, and she was able to go on vacation and go up and down stairs and go on all these hikes with her family. And they thought that was not going to be possible. Like, they were trying to find a way to still go on the vacation, but maybe not being able to modify things so it better fits her. But they were able to do everything they planned.
That's got to make you feel great, don't it?
Yeah,
You
for
could
sure.
tell. I mean, because that story just came right out of you. So you remember, and you kind of put yourself back in that situation. I could tell, and just hearing that, it can inspire others to say, "Hey, what you do really helps people," which is great. So as we wrap up here, can you provide our listeners a phone number as well as a website to get a hold of you?
Yeah, so the phone number is 407-708-9918. And then the website is New Horizons Rehabilitation. So the practice's name is New Horizons Physical Therapy, but the website is newhorizonsrehabilitation.com.
Dr. Dan, thank you so much for providing valuable insight, for our listeners about your business. And we're so excited and, wish you much success, continued success in the future.
Thank you. Thanks for having me on.
You're very welcome.
Thank you for tuning in to First Media Consulting Podcast. If you enjoyed the podcast, subscribe today. To nominate a business you would like to recommend to be on our show, go to firstmediaconsulting.com or call. Thank you for listening.